Good afternoon to everyone and welcome to today's session. We also invite the online community. Slightly we are late by about half an hour as usual because 3 hours paper definitely require 240 questions paper definitely require 240 minutes. So we'll make the great start. A tumor in the cerebellopontine angle, it doesn't involve the hypoglossal. Why? Because you know 5th, 6th, 7th cranial nerves are all located in pons. 3rd, 4th is in medulla. 8th, 9th, 10th everything is in 8th, 9th, 10th in medulla. 3, 4 is in midbrain. So hypoglossal is mainly in the medulla. So the vestibular is at the pontomedullary junction. Still vestibular, cochlear, facial, all of them get involved once the CP angle tumor is there. Even the 5th cranial nerve is also involved, is what need to be remembered. Now, coming to the various brainstem nuclei, which is the favorite question of the examiner. What is nucleus ambiguus is important. Nucleus ambiguus is located in the medulla. It is important for the control of the muscles of the larynx and the pharynx, and glossophamgeal, vagus, cranial accessory. It is a common motor nucleus for all the three. It does not carry any parasympathetic fibers, is what need to be basically remembered. Anterior 2/3 of the tongue, who carries the taste, doctor? It is the 7th cranial nerve, is what need to be remembered. Preganglionic parasympathetic fibers in the greater petrosal nerve. This is one question I want to fully make you remember, because in the tomorrow's NEET exam, if at all it exists, you are going to definitely have a question on greater and lesser petrosal nerve. The preganglionic parasympathetic fibers from the superior salivatory nucleus will come and synapse in the pterygopalatine ganglion. From here the postganglionic parasympathetic fibers in turn will go and they supply the lacrimal, nasal and palatine glands. We have tears, we have nasal secretions, we have palatine secretions, all because of superior salivatory nucleus, and we need to remember pterygopalatine ganglion. In one more question I will talk about inferior salivatory nucleus. Now doctor, which nucleus is important to receive the proprioceptive information from the muscles of the mastication is important to be remembered? Trigeminal. Trigeminal is a very extensive cranial nerve nucleus. It has a sensory nucleus, motor nucleus, midbrain it has a mesencephalic nucleus. So it is a mesencephalic trigeminal nucleus which receives the proprioceptive information which comes from the muscles of the mastication, and it is associated with the trigeminal, is what need to be remembered. There is one more speciality for the mesencephalic nucleus of the 5th cranial nerve. What is that? It is the only nucleus in the CNS which has the bodies of, the cell bodies of the primary afferents. See, fundamentally what are the two kinds of nerve fibers we have, which bring information, which take information? Afferents, efferents. Generally if you look at the cell bodies of most of the muscles, afferents which come from the muscles, they are all located in the dorsal ganglia, in the spinal cord, in the periphery. Muscle ka afferent ka matlab dorsal horn in the spinal cord. Muscle ka efferent ka matlab alpha motor neuron, which is having anterior horn cells in the spinal cord. But the only exception is the muscles of the mastication, their afferents, instead of going to the spinal cord, they will go to the mesencephalic nucleus, which is the nucleus located in the central nervous system, is the speciality about the mesencephalic nucleus. Okay doc, the time has come for me to wake you all. I hope everybody got redirected to this new address. that is livestream.com/dreamslearning. Here it is, we are not, it is a free site through which we can broadcast. If you come to use your username, password and enter into the onlineMBBS.com and there you access, we end up in paying about $50 for every 1 hour of your viewing. And since we are giving you free, except very few paid customers, students. So that's the reason we shifted to this free site for the broadcast on Sundays. Now tell me, doctor, give me one confident answer. Very good. Already we have an answer coming from Dr. Shravya who says tetracycline. Is it true? Fluoroquinolones, that's good. And Anantapur, more or less nearly correct answer. Ciprofloxacin is what they have said. So doctor, the side effects of the drugs. The last moment you need to have the things in tips. Protease inhibitors, lipodystrophy. Phenytoin, verapamil. Phenytoin everybody will remember, verapamil we forget. Dihydropyridine calcium channel blocker, which also can cause gingival hyperplasia. Thiazides, furosemide, niacin, pyrazinamide, cyclosporine should be remembered for hyperuricemia and a tendency to cause gout. Then very commonly asked question, not by examiner but by the patient. Doctor, will this drug can lead to be the myopathy? Because steroid myopathy is very well publicized even in the lay press also. Even the grandma knows that if you give a statin or a steroid to her, she is going to develop the muscle weakness. So she will ask you that I read it in the regional newspaper in Telugu vernacular that statins can lead to myopathy. Is it true? So fibrates, niacin, colchicine, interferon, statins, glucocorticoids, they are known to lead to myopathy. Heparin osteoporosis, favorite question of the examiner. Steroid osteoporosis everybody remembers. Sulfonamide, amiodarone, tetracycline, they can lead to photosensitivity. Hydralazine, INH, procainamide, phenytoin, SLE, and fluoroquinolones, tendinitis. So all these things you must be buzzing with that Kaun Banega Karodpati knowledge, whether you have seen these side effects or not for the tomorrow's exam. Now doctor, preganglionic parasympathetic fibers, lesser petrosal nerve, glossopharyngeal nerve, otic ganglion, where all these words will come into a common place. We need to remember that the parasympathetic fibers, they also originate from the inferior salivatory nucleus, just like they originate from superior salivatory nucleus. They travel in the lesser petrosal branch of the glossopharyngeal and synapse with otic ganglion. From the otic ganglion, postganglionic fibers will travel along with auriculotemporal division of the mandibular nerve of the mandibular division of the trigeminal, and they finally give the secretomotor fibers to the parotid gland. So summarize: lacrimal, nasal, palatine, superior salivatory nucleus, greater petrosal nerve, pterygopalatine ganglion. You will remember the 4 buzzwords only. Inferior salivatory nucleus, lesser petrosal nerve, glossopharyngeal nerve, otic ganglion, secretomotor fibers to parotid, and auriculotemporal division of the mandibular. So these are the buzzwords which you need to remember as a group. Now coming to the spinal nerves, they do not contain brachial efferents. Brachial efferents typically originate from the branchial arches and distributed only in the cranial nerves. You know that. Second branchial arch, what is the branchial efferent? 7th cranial nerve. Like that, for every branchial arch, you know the muscles are supplied by which cranial nerve, which is the favorite question of the examiner. If you do the hemisection of the spinal cord, ipsilaterally there will be a UMN features, because corticospinal tract got interrupted by your hemisection. Hence the lower limbs below that or the muscles below that will show hypertonia and exaggerated deep tendon reflexes, which are the features of UMN in the brown sequoid. So there is an interruption of ipsilateral dorsal columns with loss of ipsilateral touch and proprioception. There is a UMN features of ipsilateral side. At the level of hemisection there will be LMN features. Then contralateral pain and temperature is gone in brown sequid is what need to be remembered. Now, which tracts do not decussate in the spinal cord? You have a spinocerebellar tract. The second order neurons of this tract will ascend along the spinal cord, reach ipsilateral cerebellar hemisphere through the inferior cerebellar peduncle and synapse ultimately in the vermis of the cerebellum. You know, no? If cerebral cortex is affected, contralateral hemiplegia, decreased power, hemiplegia. But if cerebellum get affected, ipsilateral hypotonia will be there, not contralateral. And if cerebellum is affected, strength, power is not affected. What is affected? Only tone is affected. Summarize, contralateral side, if motor cortex of the cerebral cortex is affected, contralateral power is affected, hemiplegia. Cerebellum get affected, ipsilateral tone is affected and hypotonia will be there. So this is what we need to remember. Now, what is fasciculus, cuneatus and gracilis? Cuneatus carries the afferents not from the lower limbs but from the upper limbs and thorax. Gracilis is the one which basically carries the lower limbs is what need to be remembered. Come on doctor, shoot me an answer. One confident answer. Which ATT can lead to seizures? Huh? INH, everyone very confident, nobody want to say pyrazinamide because it can have a, reach the meninges, no? Let me check what is our online students' answers. Ask our online students to shoot the answers. Cycloserine is a innovative answer coming from Dr. Dilip. Tirupati also, yes I know, I kept a mouse trap. Pyrazinamide, who will answer? Tirupati said pyrazinamide, which is wrong. INH, you are right, as rightly said by you. So Dr. Bupropion, imipenem cilastin in the antibiotics, seizures should be remembered. Isoniazid is another important drug. Then reserpine metaclopramide can also lead to extrapyramidal syndrome. Antipsychotics lead to tardive dyskinesia. Everybody knows that. Okay, doc. Neural plate, from where is it basically formed? The first stage in the neural tube formation is induction of the notochord and the precaudal plate mesoderm of the neural plate, which basically forms from the endoderm, is what need to be remembered.